So welcome, everyone. I am so thrilled to see each and every one of you for today's lunch together. I think it's a topic that many of us, and a speaker that many of us have been looking forward to for some time now. And for better or for worse, the topic of mental health in challenging times only gets more and more relevant as the times are more and more challenging. So as we keep letting people into the conversation, I'm eager to start it. As always, our speaker will speak for 20 to 30 minutes, and then we'll have some time for questions and conversation. And so without any further ado, I have the great pleasure of handing you over to Jonathan Goldbloom, who will introduce Dr. David Goldbloom. And yes, there is a relation. And just so that there's a heads up, both Goldblooms, you are currently unmuted.
Thank you.
Thank you, Rabbi. Welcome, everyone. It's my pleasure to introduce my favorite cousin. He paid me to say that. David, as everyone knows, is a distinguished psychiatrist who has really been head of the Mental Health Commission and works at CAMH and really is an expert in psychiatry and one of the most prominent psychiatrists in Canada. I thought I would introduce him by just telling you 4 things that you probably don't know about David. David is an award-winning author. He's written a book, A Week in My Life as a Psychiatrist, which has been on Canada's top sales list for a long time when it first came out. He's one of the distinguished Goldbloom authors. Michael and I have a lot to catching up to now that we have my mother, my uncle, and my father and David who have all written books. 2, David is the past chair of Stratford, where he and I served on the board, and in recent years has been host of a fascinating program, which are Conversations with David Goldbloom, where he's had guests that are friends of his that have come and he's done interviews with them. This year, I know he was supposed to interview Bob Bray. I don't know who else was on the agenda. And when Stratford reopens, hopefully next year, I encourage everyone to go. 3, as David recently shared with me, he was quite successful as a camper at Camp Nominang, where he shared his shield with me. And you'll be surprised to know that he got his most feathers in entertainment. And 4, David has long had a checkered career with Temple. And that David, as I recall, was at my sister's confirmation, where he and his uncle shared a joke and couldn't stop laughing and were eventually asked to leave the sanctuary. So I assume that David will be relatively entertaining this evening or this afternoon, combining humor with a great deal of expertise. So without further ado, my favorite cousin, David.
Well, thank you, Jonathan. That's the most original introduction I've ever had. And for those of you on the call, I want you to know that I grew up knowing Jonathan as Johnny, not Jonathan. I don't think I ever heard that term used except by his parents in a reprimand when Jonathan became a little more formal for meting out punishment. And of course, John was reprimanded with some frequency. First of all, I want to begin by wishing you all well in this uncertain time of COVID, because there is nobody who is in some way unaffected by what has happened, not simply to our families and our lives and our communities, but our world entirely. And I'm really pleased that your Temple community is leveraging technology to sustain cohesion and to provide leadership, both of which have been sorely lacking in the last week in our neighbors to the south. And it has been a devastating experience to watch daily a country that many of us have deep connections to, torn asunder and not led. And it's really an awful thing. But I want to turn my attention to the issue of mental health in challenging times. And those challenging times, indeed, for us in Canada, are COVID and its consequences. And anybody who belongs to any kind of religious organization knows that we place great stock in looking at history, looking at past texts to understand our present and to think about our future. There are things that we can look to and draw from with COVID in the realm of human disaster. The one that's perhaps the closest to mind for many people is 9/11 and what happened in New York in the wake of 9/11. And this was studied quite extensively. And it probably won't surprise you to know that after disasters like that, most people are quite resilient, do not succumb to illness, and some indeed find new strengths. However, there are, as in all disasters, people who are at heightened risk, people who are more vulnerable, and particularly that is true in the time of COVID. And the obvious communities that come to mind are the elderly, and I now, being past 65, include myself in that community. People who are immunocompromised, people who are living in a congregate setting, a retirement home, a nursing home, or a shelter, or a jail. People who have coexisting serious physical and mental illness, people who are involved in substance use, and another important category to bear in mind, healthcare providers. I'm speaking to you as somebody who worked through SARS in 2003, when Toronto was the epicenter for North America of SARS, where every single day, as chief of the hospital, I had to oversee people masking and gowning and taking all kinds of extraordinary precautions. And the main casualties in Toronto were healthcare workers, not simply in terms of their physical health, but even in terms of the stigma that they experienced from the community at large, who was understandably terrified of contracting SARS. In one of the studies that looked at what some of the lessons learned were from 9/11, there's a quote that I think is particularly germane to your Temple community. Those people who aligned their personal values, such as friendship, social bonds, spiritual and religious pursuits, kindness to others, and compassion, they aligned those with their responsibilities while still acknowledging the emotional weight of the attack, fared particularly well in terms of low rates of psychological complications and increased resilience. Many of those people experienced a sense of control, self-esteem, and belonging by providing emotional and practical support to family, friends, and the larger community, and interpreted their actions in a positive manner. Many discovered a way to move forward with the rhythm of life, and some thrived. So the lessons learned really emphasize the importance of finding a way to engage with and appreciate life during this kind of terrible event, and that's actually a pretty robust predictor of psychological well-being and reduced post-traumatic stress. And so somebody came up with what's called the 3C model for boosting your resilience during a natural disaster. And the first C is control. Establish routines. Limit your exposure to news. Remember that anytime you turn on to CNN, they come back from every commercial with the word breaking news. Why do they say that? They say that so you can't turn off the television, so that you will feel that if you miss something, you'll be behind. They keep breaking the same news hour after hour after hour. Coherence is the second C. And what do they mean by coherence? Making sense of what has happened, including what is beyond our control. And then the final C is connectedness, the value of social support. One of the things that's bothered me throughout this pandemic is the casual use of the term social distancing, right? And I'm sure all of you have heard governments call for social distancing. This is a completely incorrect, negative, and dangerous term. The term is physical distancing. Social distance is actually a sociological concept around stigma and discrimination. And this was actually developed by Canadian sociologists to measure stigma and discrimination. And what they defined as social distance is, how willing would you be to have a friend who is X? How willing would you be to have a brother or sister marry someone who is Y? How willing would you be to work with someone who is Z? That's what social distance means. And so it is a distortion of the term to use it when what you really mean is physical distance. What are we concerned about during a time of physical distancing? Well, there's a concern for the real risk of an increase in people's anxiety, depression, substance use, loneliness, domestic violence, and child abuse. And this means we've got to do things to try to minimize the likelihood of those things occurring. Now, first of all, as we're using today, digital technology in an unprecedented way allows us to bridge physical distancing. All of us, at a time when we may be away from our work or our volunteer roles or our social roles, need to develop structure and routines that define our day. We should try to actually restrict as much as possible the amount of information that we take in. And this is where digital technology is our enemy rather than our friend, because people are hyper responsive to alerts that come in on their phones, complete with musical cues that make us respond like pigeons in a laboratory experiment, always checking at a time when we then relinquish our control of our schedules and our lives, instead deciding when we will watch the news, when we will respond to emails or to texts. What do we know so far about the mental health impact of COVID in Canada? And it's amazing to me that we're only a couple of months in, but measurement is happening. Late in April, the Angus Reid polling company surveyed almost 2,000 Canadians about what their experience has been in the last 2 weeks of April. And these numbers are not going to surprise you. What percentage of Canadians endorsed feeling worried? 44%. Anxious? 41%. Bored? 30%. Grateful? 34%. Optimistic? 19%. Depressed? 16%, normal, 14%. In other words, it is wildly statistically abnormal to be feeling normal during COVID. Untroubled, then that takes us down to 11% of Canadians said they were untroubled. Happy, well, 6% of Canadians endorsed feeling happy in late April, which is not surprising. Worry and anxiety, but also gratitude, were higher in women than in men. Optimism was actually higher in men than in women. And the group that appeared the most bored were people aged 18 to 34, probably because of the profound disruption in school or first jobs. Half of Canadians felt their mental health was worse than 6 weeks earlier. But amazingly, 7% thought it had improved. And that's a reminder that not everybody was feeling great prior to COVID, right? It's really striking to me the cultural shift in Canada around the openness about talking about mental health. It has been from the get-go in every province and federally, it has been on the lips of leaders, of public health officials. And if you think back to SARS in 2003, nobody was talking out loud about mental health. Now, 50% of Canadians believed that public safety and health depends on continuing the restrictions as the most important yardstick for government decisions, while only 9% of Canadians at the end of April felt that the harm on business of being restricted should be the most important yardstick for the government to use. And I suspect that reflects a bit of a cultural difference between Canada and the United States. Now, what about worry about financial impact? And the economic reality of COVID is that it exposes what already existed, the extraordinary disparities in income, in precarious employment, in precarious housing that exist across a gradient in Canada. So who's worried about money? Well, 22%, 1 in 5 Canadians are really worried about money, and almost half of Canadians are somewhat worried about how they're going to cope financially. Only 8% of Canadians said they're not at all worried financially. So they've got a significant cushion. Now, there are 25% of Canadians who are working from home, and there's another 17% who are not working due to the pandemic, and 17% of Canadians who still have to go to work. They are essential workers in nursing homes, in road crews, all kinds of walks of life where they do not have the luxury or the option of working from home. And these are individuals who on a daily basis are taking on significant risk. And that includes the healthcare workers who are working in COVID environments. And I know many young physicians and nurses who are now living apart from their families, or when they get home, they have to doff all their clothing and wash every single thing that's on them before they can enter their houses. They're scared to touch their families. This is a huge problem. We also know from a survey that just came out from CAMH, looking at 600 Canadian youth between the ages of 14 and 27. 68% of them said they were having problems with anxiety and depression. And that really related to the disruption in their education and employment. One of the things that we worry about is death. And we worry about it in terms of the deaths from COVID directly, from a consequence of the infection. But we worry about death from other reasons. People not seeking or not being able to access the health care they need for other conditions, and that may have fatal consequences for them. But there's also the concept of deaths of despair. Deaths of despair is a term that refers to deaths as a consequence of suicide or drug and alcohol use. And we know that in Ontario, in British Columbia, in Quebec, the number of people who are dying of fentanyl overdoses has gone up. This was already a substantial problem with our opioid crisis. We know in the United States, suicide rates have been increasing in recent years before the pandemic. In the United States alone, 40,000 Americans die by suicide annually, and half of those die by firearm suicide. And guess what has happened since the pandemic hit the United States? Firearm sales are through the roof. Americans who already own 300 million guns have been loading up on weaponry, and that will likely translate into suicide. How does something like COVID lead to suicide? Well, there's economic stress, social isolation, decreased access to care. There's a kind of national anxiety that's exacerbated by the media, firearm sales, as I pointed out, but also seasonal variation. Suicide rates tend to peak in late spring and early summer. So we've got a perfect storm, if you will, in terms of the timing of the pandemic and the risk period for suicide. This is not meant to sound entirely gloomy, because there are things that can be done. And the things that can be done include reducing fear and self-isolation, stigma, treating underlying illnesses like depression and anxiety and substance use that put people at risk, making sure that we have appropriate shelter for people who are suffering from abuse, and that is primarily in every country women who are experiencing domestic abuse, and ramping up dramatically the availability of digital mental health services. I can tell you at my hospital, we went from doing 350 televideo assessments per month to doing 3,500 televideo assessments per month in a matter of a couple of weeks. It can be done. We also need to turn to what is considered reliable information, because as you know, there is no filter for quality on the internet. It's one of the reasons that conspiracy theories take hold. A survey just done in the United Kingdom showed that about 10% of Britons right now believe there is a COVID conspiracy. And those people who believe that there is a COVID conspiracy are dramatically less likely to follow any of the rules related to COVID. So that's bad news for flattening the curve. But it's also, frankly, bad news for Jews. Because anytime conspiracy theories promulgate, it is almost inevitable that it circles back to Jews. So what I would encourage people to do is if you want to get some sort of practical advice on things that can promote your mental health, the website of the Center for Addiction and Mental Health, which is www.camh.ca, provides information not only for individuals, but also for parents about how to talk to your children about COVID. And I know at one point the Premier of Manitoba was actually quoting some of the advice in one of his press conferences. The Canadian Mental Health Association also has some good advice. I have to say, the advice is not psychiatric. The advice is in large measure common sense and collective wisdom about the importance of community, the importance of connectedness, the importance of routine, the importance of techniques like mindfulness and meditation and yoga when people feel overwhelmed, the importance of regular physical activity, even if you are constrained and confined to your home. I realize now I've been yammering on for a half hour, so I want to make sure there's plenty of time for us to interact.